Dr. Schultz here with 920 Chiropractic. I want to talk to you today about what happens if people don't get chiropractic care. Okay, they come in, I do an exam, take some x-rays. We see the problem on the x-ray. They have degeneration within their spine. Their curves aren't right. Their discs are wearing out much faster than they should be. It's a mess. But let's say they don't sign up for care. What are their options besides chiropractic care to keep their spine and their health in check? Well, if they went to the medical doc and they had, let's say, low back pain, which so many people do, they say, "Hey, doc, I got this low back pain." What are they going to do? Well, most of the time, they hardly look at you and they don't even look at the low back. They don't even touch the low back. What do? They prescribe pain pills right away for you, maybe some muscle relaxers. And, they'll send you home. You'll go through that and you might feel a little better, but, now you're on pain pills. And that's not good for your liver, your stomach, or anything else in your body. It's just masking the symptoms. So you go back a couple weeks later, you're like, "Doc, the pain pills wore off. Problem's still here." Well, let's get some needle injections. Let's inject the spine with a corticosteroid to basically numb the nerve. Now, they can only do that for a few times in the same spot because corticosteroid actually eats bone. So they can't do it too many times because you'll end up with osteoporosis and it eating the bone out. So what's your option after steroid injections? Now they're talking about nerve ablation, which is freeze burning the nerve. And that lasts between 6 months to 2 years of relief, but you're freeze burning the nerve. You got to remember, these nerves are going to organs, vital organs. You want those nerves working properly. And after that, let me tell you, the surgeons are sharpening their scalpels for you at that point. You're looking at surgical consults and possibly surgery, which of course costs anywhere from $30,000 to $100,000. And they're putting metal in your body possibly. And it's really a flip of a coin if surgery is going to work. I mean, I've heard screws breaking loose, they're not fusing the right area, and it was actually the hip causing the pain, not the low back. I mean, a bunch of just nightmare stories. I'm telling you, you don't want to go down that route. Always get things checked out naturally first, because once you get cut open and put hardware in there and everything else, you can't go back from that. You can go back from, if spinal adjustments aren't doing it for you, or you really have a serious problem, I'd refer you out. But naturally is not going to hurt you. Don't go the serious route right away. Get in here, get checked out, do the natural thing, and you will be much happier you did it that way.